Good morning to all the spectators who are following Morning Word Talk Show this morning. As you know, our country has been fighting the COVID-19 virus since last year. For this morning interview session, we invite Professor Dina and Professor from Kuala Lumpur Hospital and Dr. Amir from Sungai Buloh Hospital to discuss the COVID-19 issue. Without wasting time, let's start the interview season. On the professor opinion, what is the COVID-19?
Thank you for your question. COVID-19 is a respiratory disease caused by the new coronavirus, which is new found in Wuhan, China at the end of 2019. The disease is called coronavirus disease 19. The virus that caused this disease is called the 2019 novel coronavirus or the other name SARS coronavirus 2.
Okay, thank you for the answer. How are people test for COVID-19?
Most tests to diagnose COVID-19 require a swab of your nose or the part of the throat behind the nose by a healthcare provider. A few tests use saliva or the other type of collection methods. For most tests, the swab or sample must be sent to lab for analysis. Some tests allow the patient to collect the sample at home and then send it to a lab for analysis. Some tests can be analyzed at the point of care, such as in a doctor's office or health clinic. The FDA has also authorized one at-home test that allow an individual to collect their sample and run the test completely at home without needing to send anything to a lab.
Okay, Dr. Amir, in your opinion, what is self-monitoring?
Okay, thanks for your question. Self-monitoring or independent monitoring is an effort to monitor health, health independently at home. If children or parents have a history of travel in the last 14 days and to an area with a local transformation COVID-19, you should conduct independent monitoring in the form of measurement and body temperature recording twice a day. Identify early symptoms of example, feeling unwell, fever, cough, runny nose, and difficult breathing. Self-supervision is performed for 14 days from the time of arrival. If this happens, take insulation measure independently. This severe illness can cause high fever, shortness of breath, and vomiting until you can not drink. I suggest you continue to go to the hospital.
Thank you for your opinion, doctor. And how about self-isolation? What do you think about it?
Insulation is a method of prevent of this case of by not leaving the house temporarily, taking 14 days after symptom appear. In addition, avoid contact with others. Wash your hand with soap and water for 20 seconds. Parents are obligated to supervise their children with unimportant grading and physical improvement.
Thank you again for your opinion, doctor. Professor Dina, what do you think about giving vitamin supplements can increase immunity against COVID-19?
Supplements in the form of vitamins are intended to overcome micronutrient deficiencies in intake food. Immunity against the transmission of various infectious disease is obtained from complete nutrient balance, adequate rest, physical activity according to age, the application of clean healthy living habits, as well as effort to prevent transmission of infection.
Okay, and how about social distancing? And will it help?
Social distancing is a term that applies to action taken by public health officials to stop or slow the spread of a highly contagious disease. Social distancing measures restrict when and where people can gather in order to stop or slow the spread of infectious disease. Such measures include limiting large groups of people coming together, causing bleeding, and cancelling events, as well as deliberately increasing the physical space between people to avoid contracting an illness. Staying at least 6 feet away from the other people lessen your chance to catch this virus.
Thank you for your answer, Professor Dina. Dr. Ami, can you tell us how often and after what activity should we cleanse our hands?
Okay, wash your hand with a soap and water for at least 20 seconds after going to the bathroom. After eating, after blowing your nose, or after touching a surface or objective object.
Thank you for your response, Doctor. Lastly, before we end this morning interview session, let me ask Dr. Ami a final question. How can we protect ourselves from the COVID-19?
Okay, for me, there are many ways to protect yourself from this virus. The best way to prevent this viral infection is to avoid contact with someone who suffered from it. Physical improvement, reduce contact, practice person hygiene, and other.
Thank you for your answer, Doctor. Before we end this interview session, I would like to thank Professor Dina and Dr. Amir for joining us this morning. Thank you again. I hope the audience can understand what has been said up to here only our interview season. Hopefully we meet another day. Thank you very much. Don't forget to stay at home and stay safe. See you next time and goodbye.